SU23 Intro to Pharmacology, Chapter 7, Cardiovascular Drugs. Chapter 7 covers drugs that are used to treat diseases of the heart and blood vessels. The cardiovascular system is also known as the circulatory system. The purpose of the cardiovascular system is to transport oxygen, carbon dioxide, nutrients, and waste to and from the cells. The pathway of the nerves in the heart controls the contractions, and this is known as the conduction system. Factors that can contribute to heart disease include sedentary lifestyle, obesity, diabetes mellitus, and smoking. We'll discuss disorders and treatment for angina pectoris, myocardial infarction, congestive heart failure, and arrhythmia. Angina pectoris, known also as angina, is chest pain. It's caused by a lack of oxygen to the heart muscle. Think about if you are running track. If you don't stretch and breathe properly, your muscles will cramp because they don't get enough oxygen. In this case, it's the heart muscle that's not getting oxygen that begins to cramp. It can be caused by arterial spasms, which is a narrowing of the arteries due to athero- or arterial sclerosis, or constriction caused by smoking, brought on by nicotine. Drugs used to treat angina will either open the vessels, those are known as vasodilators, or decrease the heart's oxygen demand. There are three primary types or classes used to treat angina. These are known as anti-anginal drugs. They include beta blockers, calcium channel blockers, and nitrates. Beta blockers work by slowing the heart rate, which decreases the demand of the oxygen on the heart. The drugs include propranolol, which is known as Inderal, and atenolol, which is known as tenormin, and they have the drug stem OLOL. So here we have propranolol. That's the generic name. And then we have the brand name, which is Inderal. So this matches your drug list. The other drug is atenolol, which is tenormin. So OLOL helps identify that it's a beta blocker, but you can use the 10 in atenolol to help you identify it's tenormin, and we want to normalize the blood. We also use it for blood pressure. It can be used to normalize blood pressure. Calcium channel blockers block the movement of the calcium ions through calcium channels in the smooth muscle layer around the coronary arteries. With less calcium available, those muscles relax and coronary arteries dilate, which increases blood flow to the myocardium and relieves angina. So basically what they're doing is they're increasing blood flow, which increases the carrying of the oxygen to the heart muscle. The drug on your list is amlodipine, which is available by the brand name of Norvasc, like normal vasculature. Some, but not all, generic calcium channel blockers will have the drug stem of dipine. Diltiazem and verapamil are the exceptions. Diltiazem is available by many different brand names. Some of them include Cardizem, Cartia XT, and Tiazac. Please be aware of the drug alert in the chapter. Diltiazem, two of its brand names, Tasha XT and Tazac, can be taken in unique ways. Their capsules can actually be open and the contents can be sprinkled on a spoonful of applesauce and then swallowed. Nifedipine and verapamil will cross the placental barrier and can cause birth defects. So those are contraindicated during pregnancy. Next are the nitrates. Nitrates have a mechanism of action as being a vasodilator. They dilate the coronary artery, increasing blood flow and therefore increasing oxygen being carried to the heart muscle, which helps relieve the chest pain. The drug stem for nitrates is Nitra. Your textbook talks about isosorbide, but it's incorrect in the way that it has it listed. There are actually two different isosorbides. Isosorbide dinitrate, which is isodyl triturdose. The trade name Dilatrate SR that the book notes is no longer available. And then there is another type of isosorbide, which is isosorbide mononitrate, which is known by the brand name of Imdur. The most common form of nitroglycerin is going to be used for emergencies. It can also be dosed as a maintenance medication, however. Commonly for an emergency, sublingual nitroglycerin comes as a tablet or a spray, as we see pictured here. Nitrostat is a sublingual tablet. Nitrolingual is a spray. It sprays on or under the tongue. Oral nitroglycerin must be protected from moisture and light, so the sublingual tablets are stored in their original glass container with a metal screw cap. These are never stored in a vial like we would for other prescription medications with a child, and we don't want to ever put it in a child-resistant cap. This is an exception to the Poison Prevention Act of 1970. This is an emergency drug, and we don't need any barriers for a patient to be able to access it. Please note the drug alert. Male patients using phosphodiesterase 5 inhibitors or PDE5 inhibitors, such as sildenafil, Viagra, for erectile dysfunction should not use nitrates with those drugs. It can cause a potentially lethal interaction due to a significant drop in blood pressure that can actually cause the heart to stop. And as I said before, the drug stem for a nitrate is nitra. Other dose forms for nitroglycerin are more of a maintenance medication. So here I have Nitrobid. This is an ointment. And on this image, we see this paper that comes with it. The dosing is actually measured in inches, and then the paper is taped to the chest wall for the patient. Another transdermal application is a nitroglycerin patch, known as Nitrodur. It is important when patients are using a patch that they only leave it on for 12 hours. They should have a 12-hour nitroglycerin-free period. That's usually while they're sleeping. Nitroglycerin can cause a drop in blood pressure. We don't want somebody's blood pressure to drop while they're sleeping and have them not wake up. It is important to note that many times patients will come into the emergency room thinking they're having a heart attack. And when they go to put the leads on the patient, they find out they have old nitroglycerin patches still in place. So patients also need to be educated that they need to remove the old patch before applying a new patch. Next is a myocardial infarction. A myocardial infarction is a scientific word, or MI, is a scientific way to identify a heart attack. So infarction means damage to tissues, and if the blood flow is too restricted, the tissue will actually start to necrose. It will actually die. The drugs that we use to treat myocardial infarctions include beta blockers, ACE inhibitors, glycoprotein 2 beta and 3 alpha inhibitor drugs for myocardial infarction, P2Y12 receptor antagonists. So drugs given during a myocardial infarction are to limit the size of the damage and increase the patient's chance of survival. A beta blocker is going to have a drug stem of OLOL. An ACE inhibitor is going to have a drug stem of PRIL. We'll talk about that later in this chapter. Acute coronary syndrome also includes any conditions that can result in a stop or reduction of blood flow to the heart muscle. So drugs that we use to treat acute coronary syndrome include the glycoprotein 2 beta 3 alpha inhibitors, such as etifabatide, which is known as Integralin. This drug is given as an IV. And also P2Y12 receptor antagonists such as clopidogrel, which is known by the brand name of Plavix. Both of these this drug will decrease the formation of blood clots so that the blood does not get blocked. There is a drug alert with clopidogrel, Plavix. This was the first of the P2Y12 receptor antagonist drugs approved by the FDA. It should not be taken with grapefruit or grapefruit juice because that will decrease the drug's effectiveness. Both of the glycoprotein inhibitors and the P2Y12 receptor antagonists are considered antiplatelet drugs because they reduce platelet aggregation. When platelets are not allowed to stick together, it decreases the risk of the formation of the blood clot. Next is congestive heart failure. The drugs we use for heart failure or congestive heart failure are ACE inhibitors, angiotensin II receptor blockers, a combination alpha-beta blocker, beta blockers, cardiac glycosides, diuretic drugs, HCN channel blockers, and SGLT2 inhibitors. Now, heart failure is when the heart is unable to pump blood adequately. Heart failure, or HF, is usually used in describing right side failure where there's not enough blood being pumped to the lungs to get oxygen. The blood may back up into the body with symptoms of swollen feet, hands, or abdomen. CHF, congestive heart failure, is progressive, including left side failure, where the heart can't meet the needs of the body due to blood being backed up into the lungs and causing pulmonary edema. Well, meet the needs of the body, and my notes have gone off kilter here, but it's due to the lack of the left side being able to pump it out to the body. The blood therefore can back up into the lungs, causing pulmonary edema, and that can leave the patient with kind of a gurgling underwater breathing sound. We see that imaged here with left side failure. It's not pumping the blood out to the body, so it backs up into the lungs, and we see that fluid being in the alveoli. So in treating congestive heart failure, the first line treatment will usually be an ACE inhibitor or an angiotensin receptor blocker known as an ARB. ACE inhibitors, ACE, ACE, stands for angiotensin converting enzyme. These drugs will block that enzyme, and by blocking that enzyme, it does not let the body make a chemical that becomes a potent vasoconstrictor. When we block ACE, it helps the arteries dilate. There's actually vasodilation. The coronary arteries will dilate, and this provides more oxygenated blood to the myocardium to help improve its pumping action. These drugs end in pril, and the example on your drug list is enalapril, which is known by the brand names Vasotec for the tablets, or Apanid, which is an oral solution. The drug stem for identifying an ACE inhibitor is pril, and you want to note that they do have an odd side effect, which causes the patient to have a dry cough. It's usually just not something the patient likes, but it's not harmful. Next are angiotensin II receptor blockers, which we call ARBs for short. These will block the action of angiotensin II, that potent vasodilator. It gets produced, so the ACE inhibitor stops it from getting produced, but if it gets produced, we can actually block it at the receptor. This means that the outcome is very similar to an ACE inhibitor. It's going to let the blood flow to the heart and actually help with the pumping. If you think of an ACE inhibitor as a barricade at a concert, it will block most from getting in, but the ARB is the bouncer at the door. The drug stem for an ARB is sartan. They don't have that same side effect of cough as an ACE inhibitor. And here we have the drug valsartan, so that drug stem sartan. Diovan is the brand name. Both ACE inhibitors and ARBs have a diuretic effect, which also helps reduce fluid from the body, and they can cause hyperkalemia. They can cause an elevated level of potassium, in addition to the vasodilating properties. Alpha beta blockers. This is a combination drug of both an alpha and a beta receptor blocker. This decreases the heart rate, which reduces the workload on the heart and decreases blood pressure. So the drug on your list is carvedilol, which is known by the brand name of Coreg. And alpha beta blocker combinations will have a drug stem of either ALOL, OLOL is a beta blocker. An alpha beta blocker, we add the A for the alpha with the LOL from the beta. Or it's going to have an ILOL like here with carvedilol. Beta blockers block the action of epinephrine at beta receptors in the heart. This slows the heart rate and decreases the myocardium's need for oxygen. That's the heart muscle. These drugs also block beta receptors in the smooth muscle layer around the arteries, which allows the coronary arteries to dilate and lets more oxygenated blood flow to the heart muscle. It also decreases the blood pressure against which the heart has to pump. There are many beta blocker drugs available, but only metoprolol has been shown to decrease hospitalizations and deaths due to congestive heart failure. So previously with angina, I was talking about propranolol. This is metoprolol. Notice it's toe in the middle. Metoprolol. This drug has two brand names because there are two formulations. There's metoprolol tartrate, which is low pressor, and this helps us identify because it can also be used for blood pressure. It lowers pressure. And then we have metoprolol succinate, which is an extended release version, and that's Toprol XL. This is where we get a lot of confusion with people mispronouncing the drug name metoprolol. Succinate is the extended release and tartrate is the regular release. And we have that drug stem of OLOL. Cardiac glycosides are digitalis drugs. These are also known as cardiotonic, right? When you're working out, you want to tone your muscles. That gives increased strength. So cardiotonic is increasing the strength of the heart's ability to pump, but it doesn't increase the work to do the pumping. So think about when you tone up, it's not as much effort to lift something because you're stronger. There's only one drug in this group, and here we have the image of the foxglove plant, which is where digitalis originally came from. The one drug is known as digoxin, brand name Lenoxin, and also Digitec. Now, digitoxin has a narrow therapeutic index, and patients can easily experience what we know is dig toxicity, especially if they are using other drugs like furosemide, which is a diuretic, and because of diuretic takes fluid off, it can increase the serum levels of digoxin. So it's very important for the patient to be aware of symptoms of dig toxicity, and the dosing is going to be very tightly controlled when using digoxin. Now, because of that narrow therapeutic index and the risk of digoxin toxicity, there is an antidote. The antidote is known as digoxin immune fab, which is known by the brand name of Digifab. In treating congestive heart failure, We also use diuretic drugs. These help promote the excretion of sodium and water by the kidneys. This relieves the excess fluid and edema in the extremities or the congestion and pulmonary edema in the lungs that is seen in patients who may have congestive heart failure. The diuretics are discussed in Chapter 10. These diuretics are specifically used to treat the edema associated with congestive heart failure. They are all potassium-sparing diuretics. They will keep the potassium level in the blood within the normal range. Other diuretics tend to cause potassium levels to drop. So a potassium-sparing diuretic is spironolactone, and it's known by the brand name of aldactone. The HCN channel blockers are located in the SA node or the sinoatrial node, which is the pacemaker tissue of the conduction system of the heart. The HCN channel inhibitor drugs inhibit the flow of ions into the SA node and decrease the heart rate. This drug helps to decrease the rate of hospitalization in patients with congestive heart failure. The drug is ivibradine, which is known as Corlinor. And sometimes we see with car drugs, they'll have cor for part of the drug name, which is Latin for heart. This drug is taken orally, and this is actually an oral solution, or it comes in the tablet form. SGLT2 inhibitors are best known as treatment for type 2 diabetes because they decrease the resorption of glucose from the renal tubules and decrease the levels of glucose in the blood. However, one drug is used in the treatment of congestive heart failure. That drug is dapagliflozin, which is known as Farxiga. It decreases the resorption of sodium and water from the renal tubules back into the blood and decreases blood pressure against which the heart muscle must pump. So this actually has a diuretic property to it. And when we talk about the SGLT2 inhibitors in the endocrine chapter, we'll talk about the drug stem being gliflozin. We also have combination drugs for congestive heart failure that contain a peripheral vasodilator such as hydralazine, which will be discussed in the next section, and a nitrate drug, isosorbide, discussed previously, or two angiotensin II receptor blocker drugs like the one pictured here, which is sacubitril and valsartan. Sacubitril is known by the brand name sacubitril, and it only comes in this combination drug. I've got a misspelling somewhere in here. I copied this straight from the book. It's sacubitril with a B. It only comes in this combination form. We identify the ARB by that drug stem of sartan. So this combination drug that's only indication is for congestive heart failure is known by the brand name Entresto. And if you watch TV, this is a common TV commercial that we see promoting this drug for CHF. The next disorder is arrhythmia. Arrhythmia is sometimes called dysrhythmia. It's an abnormal heartbeat, and it's most often caused by disruptions to the electrical impulse in the heart. Agents used to treat arrhythmia are usually specific to the type of arrhythmia. So there's several different kinds of arrhythmia, including bradycardia, atrial flutter or fibrillation, ventricular tachycardia, ventricular fibrillation, and asystole. So bradycardia is a slow heart rate. It is treated with drugs that will increase the heart rate, such as atropine. Atrial flutter or fibrillation, this is a type of arrhythmia that increases the risk of blood clots. Ventricular tachycardia, tachycardia means rapid heart rate, is due to an increased rate where the chamber cannot fill properly. So drugs used to treat this type of arrhythmia are meant to slow the heart. And ventricular fibrillation, which is the most dangerous type of arrhythmia, can lead to cardiac arrest. Asystole is when there is a lack of heartbeat or pulse. So here I got this image because it's kind of showing you where things are occurring. So again, bradycardia is a slow heart rate. It's treated with a drug that will increase heart rate. The drug is atropine. Atropine is an anticholinergic agent, and it's used to treat bradycardia. This is what we see packaged that we put into a code card. So if somebody's starting to crash, their blood pressure is dropping, their heart rate is dropping, they could give them atropine to speed up their heart rate. Atrial fibrillation is treated with an antiarrhythmic drug such as dofetilide, dronedronone, flecainide, ibutylide, propafenone, or quinidine. Digitalis drugs such as digoxin, beta blockers drugs, esmolol, propranolol, or sotalol, and calcium channel blockers such as verapamil. So here we have the antiarrhythmic drug propafenone, which is known by the brand name Rhythmolol. Remember, the patient's got arrhythmia. We want to get it back into rhythm. Ventricular tachycardia occurs when the heart rate exceeds 120 beats per minute. The heart contracts with a regular rhythm, but the heart's chambers cannot fill completely with blood between each contraction, which results in inadequate amounts of blood being circulated. All of these drugs will slow the electrical impulse in the conduction system and decrease the heart rate. Ventricular tachycardia is treated with antiarrhythmic drugs, adenosine, disopyramide, flecainide, propafenone, and quinidine, as well as beta blockers and calcium channel blockers. Ventricular fibrillation is the most dangerous type of arrhythmia and can lead to cardiac arrest. Ventricular fibrillation occurs when the heart muscle around the ventricles, which are the bottom chambers of the heart, quiver instead of contract. This is an emergency situation as the heart is not pumping any blood to the lungs and to the body. Amiodarone is an alpha-beta blocker that slows conduction of the electrical impulses in the heart's conduction system. Lidocaine can inhibit the flow of sodium ions into the myocardial cells, which also slows the conduction of electrical impulses and establishes regular contractions. So here is amiodarone. It can be taken orally, and then we also have it in the hospital in a pre-made bag. The brand name for the oral is Pacerone, and Nexterone is the IV. In the hospital, a patient is given amiodarone intravenously to treat ventricular fibrillation, but when they get discharged, they would get a prescription for the oral tablets. Lidocaine is only given intravenously to treat ventricular fibrillation. It is considered to be a local anesthetic. It ends in cane, but this is the only one that can be administered IV, and it's only given for ventricular fibrillation. So we see in the red lettering, it says for intravenous, it should say. Maybe that's the one in your textbook for cardiac arrhythmias. Asystole occurs when there is a complete absence of a heartbeat or pulse and there is no electrical activity in the heart's conduction system. This is known as cardiac arrest. It is technically not an arrhythmia because there's no rhythm. At that point, antiarrhythmic drugs have no therapeutic effect because the heart has already stopped beating. Drugs are given as part of an overall resuscitation effort to start the heart beating again. We'll talk about that in Appendix C. For those of you who are in professions that have more intensive pharmacology courses, such as nurses in pharmacology, you'll actually learn the appropriate categories of antiarrhythmic classes. They're broken into 4 classes. Class 1 are sodium channel blockers, Class 2 are beta blockers, Class 3 are potassium channel blockers, and Class 4 are calcium channel blockers. The blood vessels are vascular channels in which the blood circulates throughout the body. Arteries are large blood vessels that have a smooth muscle layer in their walls. They carry oxygenated blood to all parts of the body. When this smooth muscle contracts, the internal opening known as the lumen of the artery decreases in size. This is known as vasoconstriction, and the blood pressure in the artery will increase. When smooth muscle relaxes, the lumen or the opening of the artery increases in size. This is vasodilation, and the blood pressure will decrease. Common diseases of the blood vessels include hypertension, hypotension, and hyperlipidemia, as well as peripheral vascular disease. Hypertension is known by the abbreviation HTN. Hypertension can be caused by diseases or conditions such as kidney disease or narrowing of the arteries, but often has no identifiable causes. This type of hypertension is known as essential hypertension. I picked this image because it shows what the complications are. Many times patients are unaware that they have hypertension. It's actually commonly referred to as the silent killer. But it can lead to heart disease, it can cause kidney problems, it can lead to stroke, as well as other complications. So the medications, there are 11 types or classes of antihypertensives. The first are ACE inhibitors. We've already discussed these. These are angiotensin converting enzyme inhibitors that block that ACE enzyme in the blood that converts angiotensin 1 to the potent vasoconstrictor angiotensin 2. By blocking it, there is no angiotensin 2 produced, the arteries dilate, and the blood pressure decreases. The drug on your list is lisinopril, which is known by the brand names Prinavil and Zestoril. ACE inhibitors have the drug stem pril. You can see that here. Pril, pril. And the next one are the alpha-1 receptor blocker drugs. Oftentimes we just call these alpha blockers. These are going to block alpha adrenergic receptors in the arteries, causing them to dilate and lowering the blood pressure. It's important to note that alpha-1 blockers are not the first choice of drug to treat hypertension. The drug on your list is doxazocin, which is known as Cardura. Again, cardiac, right? We've got part of the heart in that drug name. The other part here is that your alpha blockers end in ocin or azocin. Next is an alpha-2 receptor agonist, not a blocker. The neurotransmitter norepinephrine is similar in its effects to that of epinephrine. Both cause vasoconstriction and an increase in blood pressure. However, alpha-2 receptor agonist drugs will stimulate alpha-2 receptors in the brain, which decreases the amount of norepinephrine in the blood. The result is vasodilation and a decrease in blood pressure. It's important to note that alpha-2 receptor agonists are not a first-line treatment in treating hypertension. The drug here, I know it's hard to read, but if you have your worksheet, this is guanfacine, and it's known by the brand name Intuniv. A combination alpha-beta blocker drug blocks the actions of both norepinephrine at alpha receptors and epinephrine at the beta receptor. This decreases the heart rate and causes the smooth muscle layer around the arteries to relax, which results in a lowering of blood pressure. This class is also known as a combination adrenergic blocker. The drug stem may be ALOL, A for that alpha receptor blocker and the LOL for the beta receptor combination, or it has that ILOL. So again, we have carvedilol that we've talked about previously, but we also have labetalol. And there's a couple things here, right? We've got the A-L-O-L, so alpha and beta, but we've also got the beta written right in there. So the brand name, labetalol is not available by a brand name anymore. It's so old, we don't use a brand name anymore. Angiotensin II receptor blockers, or ARBs, they don't block the production of angiotensin II, but they block the receptor, so it can't work. So if angiotensin II is the key that unlocks and increases blood pressure, we're blocking that lock. The result is vasodilation and a decrease in blood pressure. The drug Stemsartan is common to the generic angiotensin II, or ARBs. Losartan is prescribed to treat hypertension. And it says in your textbook, it says to note this warning that comes on the bottle that tells the pharmacist to dispense with a patient information leaflet, which is known as a medication guide. There's a challenge that the patient needs to know that it can cause harm or death to an unborn baby, and for the healthcare prescriber to make sure that females of childbearing age are aware of that. So losartan is the generic name, Cozar is the brand name. Beta blockers block the action of epinephrine at the beta receptors in the heart and blood vessels. This slows the heart rate and dilates the blood vessels, which lowers the blood pressure. These drugs have two types of agents. They can be cardioselective and only block the action of beta-1 receptors, or they may be non-selective and block both beta-1 and beta-2 receptors. Cardioselective blockers are safer for patients who have asthma or COPD because blocking a beta-2 receptor could result in bronchoconstriction. Beta blocker drugs are no longer the first choice for hypertension. We do have that drug stem of OLOL, and as we saw earlier, metoprolol's trade name, Lopressor, lowers pressure, tells us what's going on, and Toprol XL extended length, telling us that this is the extended release formulation. Calcium channel blockers block the movement of calcium ions through calcium channels in the smooth muscle. We often refer to these as CCBs. The less calcium, the arteries will dilate, which decreases blood pressure. The drug verapamil has multiple names such as Kalin and Verolin. And then we have amlodipine, which is Norvasc, which we've seen previously. And again, we have that drug stem of dipine. I put the little asterisk there because not all calcium channel blockers have that drug stem. Diuretic drugs are often used as the first drugs prescribed to treat hypertension. They promote the excretion of sodium in water in the urine by the kidneys, and with a decrease of fluid and blood volume, it helps to lower blood pressure. Many people refer to diuretic drugs as water pills. We'll discuss these in the urinary tract chapter. Peripheral vasodilators relax the smooth muscle layer around the arteries in the legs and the arms, or the peripheral parts of the body. These cause arteries to dilate, resulting in a decrease in blood pressure. It is important to note that peripheral vasodilators are not a first choice in treating hypertension. The drugs hydralazine and minoxidil are considered to be peripheral vasodilators. Minoxidil, as we see pictured here, this is an oral tablet which is used for hypertension, but it's also marketed topical application in treatment of hair loss, and it's known by the brand name Rogaine. That's not the same drug, it is the same drug, but not the same indication. Renin inhibitors are also used as antihypertensive drugs. Renin is an enzyme that is produced by the kidneys when they think the blood pressure is too low. Renin helps produce angiotensin 1 that can get converted into angiotensin 2, that vasoconstrictor, that will help raise the blood pressure. Renin inhibitor drugs block the action of renin, so there is less angiotensin 1 produced. This allows smooth muscles in the arteries to relax and blood pressure to decrease. It is important to note that a renin inhibitor is not a first-line treatment for hypertension. Aliskiren is the only renin inhibitor drug on the market, and its brand name is Tecturna. For some patients, one medication is not sufficient to treat hypertension, so there are many combinations that can be used. It can include an ACE inhibitor or an alpha receptor agonist or an angiotensin 2 blocker, or a beta blocker, or a renin inhibitor, or a diuretic. So there's lots of different combinations. You want to note that hydrochlorothiazide, which is abbreviated here in this image as HCT, is the most commonly used diuretic drug in these combination drugs. This drug is valsartan and hydrochlorothiazide. So Diovan is the brand name for valsartan, and they've abbreviated hydrochlorothiazide, which when it's by itself is abbreviated HCTZ. They've dropped the Z off it. So this is Diovan HCT. This drug contains an ARB, sartan, and the thiazide diuretic. It is important with some of these, we see this warning label over here that it can cause dizziness. When people's blood pressure drops, especially if they stand up too fast, they may feel a little lightheaded. Now, a note on combination antihypertensive. Often patients will require polypharmacy in treating hypertension. So to increase the patient compliance, many of the drug combinations have been made into a single dose form. And that first line treatment often being a diuretic, many of the combinations are with that thiazide, hydrochlorothiazide diuretic. Other combination mixes are a mix of a calcium channel blocker and an angiotensin-related drug such as an ACE inhibitor or an ARB. Next is hypotension. So hypertension is elevated blood pressure. Hypotension is low blood pressure. It can be caused by dehydration, low blood sugar, or a side effect of medication. Mild hypotension is treated intravenously with fluids that contain dextrose to increase blood sugar levels, increase blood volume, and raise the blood pressure. Severe hypotension is caused by blood loss and shock or by an allergic reaction resulting in anaphylactic shock. Drugs that treat severe hypotension are discussed in Chapter C, the emergency drugs, intravenous fluids, and blood products. The next disorder of blood vessels is hyperlipidemia. Lipids are fat in the blood, and they include cholesterol and triglycerides. The body uses cholesterol to build cells, to form the myelin sheath around the nerves, and to make hormones, vitamin D, and bile. Triglycerides are stored as subcutaneous fat to cushion and protect the internal organs of the body and to provide an extra energy source when needed. Hyperlipidemia includes an increased level of cholesterol, known as hypercholesterolemia, and triglycerides, hypertriglyceridemia. Anything that ends in emia means it's a condition of the blood. Some types of hyperlipidemia are genetic and run in families. Cholesterol is produced in the liver. In addition to that, dietary intake of cholesterol can cause an excessive level of cholesterol in the blood. This can lead to the formation of fatty deposits within the arteries, known as atherosclerosis, as we see in this image. So we get those fatty plaques that can build up, and they can start to block the blood vessel. And when we have the narrowing, we're getting less blood, therefore less oxygen, especially in the coronary artery, to the heart, you can end up with angina. And then if it's completely blocked, that could result in a myocardial infarction. So the drugs that we use to treat hyperlipidemia, there are 8 classes. And I like this image. It's showing, here's the liver and how all of the drugs are kind of having an impact and where in the body they're doing their work. So a lot of them work directly in the liver with this whole synthesis of cholesterol. And then some are actually in the digestive system. They're going to have an impact on how much fats are being absorbed into the bloodstream. So the first drug is an ACL inhibitor. ACL stands for adenosine triphosphate citrate lyase, which is an enzyme that is needed to produce cholesterol in the liver. By inhibiting the ACL enzyme, it decreases the production of cholesterol and decreases the level of cholesterol and the LDL, or low density lipoproteins in the blood. So the drug is bempedoic acid, which is Nexletol. Bile acid sequestrants. Cholesterol is used in the liver to produce bile, and bile is stored in the gallbladder and released into the intestines to digest fat. Most of the bile then gets reabsorbed from the intestine and can be reused. Bile acid sequestrants will bind with the bile in the intestine and forms an insoluble complex that gets excreted, and then it takes cholesterol with it, which means the liver then has to use more cholesterol to produce new supply of bile. This helps lower the level of cholesterol in the blood. This drug on your list is cholestyramine, which is known as Cholestid. Fibric acid derivative drugs will inhibit the production of the lipoprotein VLDL, which is very low density lipoprotein in the liver. This helps lower triglyceride levels in the blood. These drugs also increase the level of HDL, or high density lipoproteins, which are the good cholesterol, which will transport cholesterol to the liver and then lowers the cholesterol levels in the blood. So fibric acid derivatives include the drug gemfibrozol, and that's known by the brand name of Lopid. It lowers lipids. And fibric acid derivatives have the drug stem of fibra. How I think of these is they're little fibers cleaning out your blood vessels. HMG-CoA reductase inhibitor drugs block an enzyme that's needed to produce cholesterol by the liver. By blocking it, it decreases the production of and the levels of cholesterol in the blood. Atorvastatin, which is known by the brand name of Lipitor, is one of the older drugs, and it's showing us the drug stem of statin. Sometimes they'll say vastatin. Then we also have some newer ones, rosuvastatin, which is Crestor. So that statin. It is important to note that patients should not eat grapefruit or drink grapefruit juice while taking this medication. It can cause the drug to have a side effect known as rhabdomyolysis, where the body actually starts breaking down its own muscles. It can be very painful, so if a patient's taking these medications and they're having muscle pain, they should stop immediately and talk to their doctor. And then they're also, because this is working in the liver, they're going to have liver enzyme tests to make sure that the liver is functioning properly. Now, the book does note that red yeast fermented on rice or honeybee pollen contains a naturally occurring form of the drug lovastatin. So this substance is known as Hongqiu and has been used in China as a cardiovascular drug for over 2,000 years. So some people may be taking the nutritional supplement of that red yeast in place of something like an HMG-CoA reductase inhibitor. Niacin is actually a vitamin. Oh, wrong one. I keep reading ahead. I'm sorry. MTP is microsomal triglyceride transfer protein, which is a protein that helps build chylomicrons in the intestine. They are basically droplets of fat that transport triglycerides from the intestine to the body tissues and transport cholesterol to the liver. MTP inhibitor drugs will bind to and inhibit the protein and decrease the amount of those cells and the level of the cholesterol and triglycerides in the blood. So the drug we have on the list for the example of an MTP inhibitor drug is lomatapide, which is called Juxtapid. And niacin. Niacin is actually a vitamin. It's vitamin B3. It removes those chylomicrons from the blood that would normally be transporting those triglycerides and cholesterol. Niacin also reduces the level of cholesterol, LDL, and VLDL in the blood and helps increase the HDL, the good cholesterol. Niacin in prescription form is used to treat triglycerides. It's not generally the vitamin dietary supplement. So niacin is known by the brand names Niacor. Again, we've got niacin and Heartcore, or Niaspan. It's going to be an extended release. A couple of things about niacin. Patients have some of the side effects. It can make them feel like they're having a hot flash, so they shouldn't take these with a hot beverage. Other things that are used to treat cholesterol include omega-3 fatty acid drugs. These help reduce the liver's production of VLDL and triglycerides. Lovaza is the only one by prescription. It's also available over the counter as a dietary supplement. So we hear a lot about omega-3 fatty acids helping with cholesterol. So Lovaza is the only prescription formulation. The PCSK9 inhibitor drugs. PCSK9 is an enzyme that will bind to LDL on the surface of the liver, but normally destroys them from time to time. However, PCSK9 inhibitor drugs keep the enzyme from destroying the LDL receptors. The receptors therefore stay active longer and continue to transport cholesterol from the body to the liver. This lowers the cholesterol in the bloodstream. The PCSK9 inhibitor drugs are injected subcutaneously every 2 to 4 weeks. These are monoclonal antibodies. Evolocumab, we've got the MAB as the identifier. So these are going to be subcutaneous injections. Again, every 2 to 4 weeks. It will depend on the dosing. And then we have other drugs. So this drug is actually referred to as a cholesterol or a fat absorption inhibitor. Cholesterol is transported from the small intestine to the body through a substance known as 2-acetyltadione. Ezetimibe inhibits that substance, so the body does not absorb and carry the fat to the liver. That helps decrease the level of cholesterol and the HDL in the blood. Miscellaneous drugs for hyperlipidemia. The biggest thing about ezetimibe, which is known as Zetia, is that it decreases the levels. Now, there are combination drugs as well. Vytorin is a combination drug of etzimumab with simvastatin, which is an HMG-CoA reductase inhibitor. So there are some combination drugs for hyperlipidemia. Now, the drugs used to treat peripheral vascular disease, the biggest goal is to increase blood flow to the smaller vessels in the extremities. Peripheral vascular disease includes both arterial and atherosclerosis in the legs. The patient will generally have pain in the calves when walking. Drugs used to treat peripheral vascular disease can include drugs for hyperlipidemia, as well as antiplatelet drugs, which are discussed in Chapter 8. Now it's time for more questions.